If you're turning 65 soon and need to enroll in Medicare, it's important to know the exact time to apply in order to claim all of your benefits and prevent unnecessary penalties. Hi, my name is Ruby with Trusted Senior Specialist, and today we're going to discuss the 5 crucial Medicare enrollment mistakes most Medicare eligibles make. Today we're covering mistake number 1, misunderstanding enrollment periods. In this video, we'll go over Medicare's 3 key enrollment periods and the best times to apply. Let's get started. First step is initial enrollment period, also known as IEP. If this is your first time enrolling into Medicare, you're going to apply during your initial enrollment period. During IEP, you have a 7-month window to apply for Medicare, up to 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after you turn 65. If you are new, it's best to enroll in a plan during the first 4 eligible months. If you miss your initial deadline because you're waiting for open enrollment period, and if you do not have credible coverage through an employer or your spouse's employer, you are risking delayed coverage and permanent late penalties. Starting early will give you time to shop around and talk to a professional and ask necessary questions before you commit to a plan. Next is special enrollment period, also known as SEP. If you've encountered certain life events such as losing health coverage, moving, becoming disabled, you qualify to enroll during this special enrollment period. If you or a spouse are still working, you can apply during the 8-month period that begins the month after your employment coverage ends, or any time during your group health coverage, whichever comes first. Finally, we'll talk about general enrollment period, also known as GEP. GEP is for those who missed their initial enrollment period or their special enrollment period and need to apply for Medicare Part A and or B. This period begins January 1st through March 31st of each year. If you enroll during this time, you're liable to encounter annual penalties for enrolling after your initial enrollment period. If you had a major life event, you qualify to enroll for the special enrollment period. Remember, if your spouse is still working and you're on group coverage, you can apply during the 8-month period that begins the month after your employment coverage ends, or any time while you have group health coverage. And lastly, if you miss both your special enrollment period or your initial enrollment period, you have your general enrollment period, which starts January 1st and ends March 31st to enroll in Medicare Part A and B. But remember, that comes with an annual penalty. Have a question about when to enroll Medicare? Leave us a comment below or set up an appointment to talk to our licensed Medicare experts at Trusted Senior Specialist. And don't forget to leave us a comment, subscribe to our page for more Medicare advice, tips, and updates. Until next time, I'm Ruby, and I'm wishing you the best of health and sending you loads of love.